If you're taking amlodipine, you have to avoid a few things. Amlodipine is a calcium channel blocker. It produces the relaxation of your arteries, which results in the reduction of your blood pressure. It may be given to you to reduce your blood pressure and to control the pain in the angina. However, this medication can produce a few side effects that are well tolerated and a few other side effects that may be severe when its levels are elevated in your body. The extent of side effects of amlodipine may be variable from person to person. Few people may observe very mild side effects. However, few people may observe significant and intolerable side effects. Due to dilation of arteries, amlodipine mainly produces a few common side effects like dizziness, lightheadedness, fainting, and postural hypertension. It may also produce swelling in your legs, ankles, and hands. Few people may experience irregular heartbeats with severe weakness. However, the extent of the side effects depends on how you are taking amlodipine and what the other coexisting factors are. Your food habits may affect the treatment's efficacy as well as its side effects. When you take other medications, they may impact the levels of amlodipine in your body. This may significantly increase the side effects produced by this medication. A few things to be avoided while taking amlodipine to minimize these side effects. In this video, we will cover such important things that should be considered while taking amlodipine. Taking with food. You can take amlodipine with food. However, you should be cautious about which type of food you're going to select while taking amlodipine. Try to avoid taking high amounts of grapefruit juice along with amlodipine. Grapefruit juice contains few of the chemicals called furanocoumarins. These components can inhibit the breakdown of amlodipine. Therefore, when you take the amlodipine along with grapefruit juice, the levels of amlodipine may be abnormally increased in your body. This may produce significant hypotensive effects leading to dizziness, lightheadedness, fainting, and leg edema. You may have symptoms of postural hypertension that result in sudden falling while you stand. Therefore, never take the grapefruit juice along with the amlodipine. Alcohol can have additive effects on amlodipine. If you're drinking low amounts of alcohol, it may not have a significant effect. However, consuming large amounts of alcohol may produce drowsiness and dizziness. Therefore, alcohol may worsen your dizziness, nausea, and sleepiness. If you notice significant lightheadedness with use of amlodipine, it is better to avoid intake of alcohol. The effectiveness of amlodipine treatment depends on your lifestyle and food habits. Consuming foods containing high sodium may have an adverse effect on the efficacy of amlodipine. Salty snacks, processed meats, and canned soups contain high amounts of sodium. Consuming such types of foods may increase your blood pressure, which reduces the efficacy of amlodipine treatment. Therefore, try to cut high sodium-containing foods from your diet. Fat can have another effect. Taking amlodipine with a high-fat meal may reduce its absorption. It may also delay or even reduce the effectiveness of amlodipine. Consuming high-fatty foods may also block your arteries by increasing the risk of deposition in the blood vessels. Therefore, try to avoid fried foods, processed dairy products, and fatty meats that contain high-fat content. You may add the diet that is healthy for your heart and prevents your blood vessels from damage and blocking. Try to add fresh fruits and vegetables and include whole grains in your diet for better control of your blood pressure. Caffeine can increase your blood pressure. Taking a larger number of cups of coffee can have a counteracting effect on amlodipine. A similar effect can be observed with the intake of energy drinks. Therefore, try to limit the intake of coffee and energy drinks, especially if you have high blood pressure. Antibiotics. Macrolide antibiotics like erythromycin and clarithromycin are given to control bacterial infections. They can be given for a variety of bacterial infections, including community-acquired pneumonia. These macrolide antibiotics can inhibit the metabolism of amlodipine. Amlodipine is extensively metabolized in your liver. Cytochrome P450 enzymes like CYP3A4 play a key role in this breakdown. These antibiotics can inhibit the activity of cytochrome enzymes, which increases the levels of amlodipine in your body. With that, you may experience enhanced side effects of amlodipine. You may have increased hypotensive effects leading to lightheadedness. Taking these antibiotics may also increase the risk of acute kidney injury that can affect amlodipine levels in your body. Therefore, it is better to use an alternative macrolide antibiotic while taking amlodipine. Azithromycin has less significant interaction with amlodipine. Therefore, it can be used. Painkillers. If you're taking painkillers for a short period, they may not have an adverse effect on amlodipine. However, when you're using painkillers for a chronic period, they may reduce the effectiveness of amlodipine. Many medications like ibuprofen or naproxen may adversely affect your blood pressure. They can counteract the effects of amlodipine and reduce its efficacy. On chronic use, they can also affect your kidneys. They may reduce the rate of filtration of your kidneys. They also reduce the blood flow to the kidneys. Chronic use of painkillers is also associated with cardiac problems like heart attack and stroke. Therefore, whenever you need pain relief, try to choose painkillers that are safer. You can take acetaminophen for controlling the mild pain, while taking amlodipine. Statins. Statins are the medications that can be used to regulate your elevated cholesterol levels. Medications like simvastatin, atorvastatin, and rosuvastatin are few examples in this category that are used to control elevated cholesterol levels. These medications can reduce the risk of blocked arteries. They can also minimize the cardiovascular complications. Generally, people with hypertension may be associated with elevated levels of cholesterol and blocked arteries. Therefore, you may have a high chance of taking amlodipine along with statins. However, when you take the statins at higher doses, it may impact your muscles. Amlodipine is not directly producing any adverse effect on the muscle. However, when it is taken with statins, it may interact in a different way. Statins are metabolized in the liver, and this metabolism is blocked by amlodipine. This is due to competition between the metabolic enzymes in the liver. Amlodipine may have more affinity towards metabolic enzymes, which protects the statins from their breakdown. This increases the levels of statins in your body, leading to adverse effects on the muscles. This is particularly more pronounced when you take statins at higher doses. This may result in muscle cramps and muscle stiffness. Particularly the muscles at the arms, legs, and shoulders may be affected. It can also affect the muscles of the heart and breathing muscles. You may feel weak and have difficulty while climbing stairs or lifting objects. Under very high doses, it may result in a condition called rhabdomyolysis, which results in the breakdown of muscle tissues. It is one of the serious conditions that can be observed with a very high dose of statins taken with amlodipine. Therefore, always try to avoid higher doses of statins with amlodipine. Amlodipine can increase the levels of simvastatin. Therefore, you should never take simvastatin at a dose above 20 milligrams per day while you take amlodipine. Other statins like atorvastatin and rosuvastatin have no significant interaction with amlodipine. You can get amlodipine and atorvastatin in a fixed combination. Nevertheless, you should be careful in monitoring adverse effects on your muscles when you take atorvastatin at higher doses. Dehydration. Severe dehydration can also produce adverse effects while you're taking amlodipine. If you're doing strenuous exercise, it may result in excessive sweating. If it is not replenished with water, it may result in severe dehydration. This may increase the risk of dizziness and fainting, particularly when you are taking amlodipine. Therefore, try to stay hydrated and avoid sudden and intense workouts without prior warming up. Medication to treat erectile dysfunction. If you're taking medications to treat erectile dysfunction, you should use amlodipine carefully. Phosphodiesterase 5 inhibitors like sildenafil, tadalafil, and vardenafil are used to treat erectile dysfunction. These medications work by producing relaxation of erectile tissue. They block the activity of phosphodiesterase type 5 enzyme. Thereby, they increase the levels of cyclic GMP. This produces the relaxation of the erectile tissue and improves the blood flow. This helps an erection. Normally, you can use sildenafil while taking amlodipine. However, there may be added effects on hypotension. PDE5 inhibitors can also produce the dilation of your arteries slightly. Since amlodipine reduces your blood pressure, this may be added to its effect, leading to increased hypotensive effects. Therefore, you may have increased dizziness, lightheadedness, and hypotension. Among these drugs, the levels of tadalafil can be increased by amlodipine. Tadalafil can be used for the treatment of both erectile dysfunction and the management of prostate enlargement. So if you take tadalafil along with amlodipine, the levels of tadalafil may be increased. So take caution when you are using this medication. Antifungals. Ketoconazole and itraconazole are the antifungal medications. They can be used to treat the fungal infections and taken orally as capsules. However, they can increase the levels of amlodipine by affecting its breakdown both in the liver and in the intestine. This may increase the levels of amlodipine, leading to more pronounced adverse effects. Therefore, if you are using antifungal agents, try to monitor the side effects of amlodipine carefully. Itraconazole can also slow your heart rate, which can be added with the amlodipine. Vasodilators. One of the effects of amlodipine is to produce the dilation of your arteries. This increases the permeability of your arteries, leading to more accumulation of fluids surrounding the tissues. This may result in edema, leading to swelling of your legs. This edema may be elevated if you're taking other medications that produce dilation of your arteries. Particularly ACE inhibitors like enalapril and lisinopril can increase the risk. Taking beta blockers like metoprolol or carvedilol can also produce a significant reduction in your blood pressure. Therefore, when you take other medications, try to monitor your blood pressure. Amlodipine can produce a condition called postural hypertension. This causes a drop in your blood pressure while you're going to stand. It may result in the risk of falling. Therefore, try to get up slowly from a sitting or lying position. If it is required, hold a support while you're standing. That's all about the things that you should avoid or be cautious of while taking amlodipine. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.